Now you can simply pause the video and you can try to find out what could be the problem in this particular ECG. Now for your kind information, this is perfectly normal ECG. Now how do you come to know whether a particular ECG is normal or not? Now ECG, it constitutes of total 12 leads most of the time, and it is all about P, QRS complex, T wave, Q wave and ST segment. So of this, we must know that P is atrial contraction wave. It is very small and it should be less than 2.5 millimeter or 2.5 small boxes in height and in width. So the height should be less than 2.5 and width should be more than 2.5, and it should be mostly positive. What do you mean by positive? Is whenever we see any particular lead, for suppose this, so this is what we call it as is a baseline. This is the baseline. So when we want to talk about positive or negative, if it is positive, it has to be above the baseline. If it is below this baseline, we call it as negative or inverted. So P wave, as I told, it should be less than 2.5 small boxes in height as well as in width. So it can be negative in the right sided leads like AVR and V1, but apart from AVR and V1, it should be positive in all the other leads. So you can simply try to see in here it is positive, the P wave in lead 1 is positive. Here in lead 2 it is positive, lead 3 is positive, lead 2 is positive, and everywhere you just see in AVR and V1 it is negative, but it is acceptable. But in V2, V3, V6, V5 and V4, everywhere it is positive. So P wave is perfectly positive. Now we'll move on to next, that is QRS segment. Now the QRS segment, we know that it is because of the contraction of the ventricle or ventricular depolarization. So the QRS, Q wave is the first negative deflection after P wave. Usually you don't get Q wave anywhere in the ECG, and very commonly you can get a presence of Q wave only in lead 3. So presence of Q wave only in lead 3 can be acceptable, but most of the time you won't see any negative deflection after P wave. So see, this is P, there is no deflection, there is no Q, it is R, it's very minor, hardly 0.5 millimeter, and it is all R and S. So you don't have any negative deflection, here also. P wave is there and directly there is a positive deflection, that is R wave. So there is no Q wave, so that is one of the normal finding. So in here the Q wave is not there, it's good only. Next wave is R wave. Now R wave is ventricular contraction or ventricular depolarization wave. R wave is the first positive wave after P. It should be positive in all the leads except the AVR and V1, just like P wave. So here you see that it is positive, everywhere it is positive, which is a good sign. And what we call it as is a R wave progression. What is R wave progression? Is in V1 and V2 we have very minimal R wave and S wave is large. In V3 and V4, R wave height is almost as equal as S wave. We call it as equalization phase. And in V5 and V6, we have very tall R wave and S will be very small. We call this as a normal QRS progression. What is here? In V1, the R is very small and S is prominent, which is the first negative wave after R wave. In V2, R is very small and S is large. So it is very typical of V1, V2. In V3 and V4, the R should be prominent and preferably R should be equal as S. But in here the R is prominent and S is very minimal. It's okay, it is one of the normal variant. And in V5, V6 we have very good R wave, which is a positive wave, and S is almost not there. So this is also a normal variation. So there is typical normal QRS or R wave progression. And S, we don't have much, we don't expect much from S wave. So in here, most of the time, the S wave is very, very small, which is perfectly acceptable. Now the next wave is T wave. Now we must know T wave is ventricular repolarization wave, and T must be positive in all the leads except some anterior leads like AVR and V1. Same as P wave, same for R wave, and same for T wave. So it should be around 3 to 5 small boxes, height and width, and it should be positively in all the lids. If this T wave is negative, then we can consider that patient may have ischemic changes, or patient may have coronary artery disease, or new onset of T wave inversion or T wave negativity may also suggest the patient may have coronary artery disease. So in lead 1, we have positive T wave. See, this is a baseline and it is all above the baseline. So in lead 1 it is positive, lead 2 it is positive. It is around 3 to 4 small boxes and hardly 2 boxes tall. In lead 3 it is not significant, so we can simply ignore. In AVL, AVF, in lead V2, V3, V4, V5, V6, everywhere the T is positive. So in short, the T wave in this ECG is perfectly normal. So P wave is normal, QRS complex is normal, T wave is normal, there is no negativity. There should not be any ST elevation, ST segment, or there should not be any ST depression. So how will be the ST depression? So we know that this is R and this is S. So if there is ST elevation, the ECG, the ST segment won't come like this. It will come like this only. So what will be apparent will be like ST elevation. So this will be ST elevation of 3 to 4 millimeter. I'll explain this again. This is R, and if there is ST elevation, it will be like this. So there will be ST elevation of around 4 to 5 millimeter, but in this case there is no ST elevation. If it would have been like ST depression, then we could have seen this as this R and S and here T. So like this you can get the ST depression here, but in this case the ST depression is not there. The S is very well prominent, and then it is followed by a positive T wave. So if there would have been any ST depression, it would have been like this, that this is R, this is S, and then this is like T. So there will be this type of ST depression, this. But here the ST depression is not at all there. So there is no ST depression, there is no T wave inversion. The all QRS, they are upright, the T wave is positive, P wave is positive. One more last thing that I would like to tell is this PR segment. Now we must know that from the beginning of P to beginning of R, there should be less than 5 small boxes, or 0.20 millisecond, 0.20 seconds. So in here we can, this should be, if it is more than this, we call it as prolonged PR, and that indicates usually first degree heart block. So we have to see whether from onset of P to onset of R there are less than small boxes. In here it is same, like there is one small box, two, three, and 3.5. So here it is 3.5, here it is around 3 boxes, small boxes, here it is around 1, 2, and 2.5. Here also it is 1, 2, and 3. So most of the time it is hardly 3.5 to 4 small boxes, means the PR is perfectly normal, there is no any block. You should also see that the heart rate is in between 60 to 100, because this is what is the sinus heart rate, and each and every P has to be followed by each and every QRS. If each P is not followed by each QRS, it may suggest that there is some block. It can be Mobitz 2 block, or it can be complete heart block, where the heart rate will vary. If it is complete heart block, the heart rate will be around 40 only, because in complete heart block, heart switches to ventricular pumping or ventricular rhythm, which is inherently 40. So if the heart rate is 60 to 90 or 60 to 100, each and every P is followed by each and every QRS, and followed by all the positive findings that I have just told. It is mostly a normal ECG. Thank you.